Welcome, everyone. On behalf of the Centers for Medicare and Medicaid Services, Division of Tribal Affairs, I would like to welcome everyone to an All Tribes consultation webinar. My name is Nicole Pino, and I work for Kaufman and Associates. I'll be your moderator today. Today's webinar is titled Medicare Open Enrollment. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. At this time, I will turn it over to Beverly Lofton.
So welcome to today's webinar. Just to let you know, so today we are going to be talking about Medicare open enrollment. So the Medicare open enrollment happens every year beginning October 15th through December 7th. So that's on a rolling basis every year. So we're going to talk about that, and then we're also going to discuss Medicare in general, go over coverage of Medicare and how that works, talk about Part A all the way through Part D. So there's a Part A, B, C, and D. So we will talk about the alphabets. Then also to let you know that materials related to this presentation can be downloaded from our spotlight page of the CMS American Indian and Alaska Native Outreach and Education website. And you can find that website at go.cms.gov /AIAN. So I'll go over that again. It is go.cms.gov/AIAN. So Medicare is a health insurance, and that health insurance is provided for folks at age 65 and older. But there are some circumstances that other age groups will qualify for Medicaid or may qualify for Medicaid. So under 65, certain disabilities, and those disabilities are ALS, and then also Lou Gehrig's disease. So you can apply or be eligible for Medicare without a waiting period. And then there's also any age if someone has end-stage renal disease. So here are the different options of Medicare. So you have the original Medicare, and then you also have Medicare Advantage. That's also known as Part C. So original Medicare has Part A and Part B. And then Part C is, again, Medicare Advantage, another name for it. So that will have your Part A, Part B, and then most of the Part C plans also cover Part D, and then you also can have some extra benefits thrown in. So some Part C plans may have gym benefits or some pay for some grocery benefits. So it just depends on the different type of Part C plan. And we'll get into that a little further on. So enrollment into Part A and Part B is an automatic enrollment. So and it's the enrollment covers folks who receive Social Security benefits or the railroad benefits. So those are the folks who get an automatic enrollment into Part A and Part B. So people who become eligible for Medicare should look for their Get Ready Medicare package. And it's typically mailed 3 months before a person turns 65. And then on the 25th month of a disability benefit. So this welcome packet will include your Medicare card. So some people may need to take action to enroll in Medicare, and you will know that. So you would have to you will need to apply 3 months before you turn 65. So if you are not going to have like an automatic enrollment, so you will need to be sure to contact or tell the people that you know, your family members, if they're about to turn 65, that they need to contact Social Security. So they can contact Social Security at ssa.gov or dial that phone number that is 1-800-772-1213. And then if you retired from the railroad, you would contact your local railroad retirement board, and there's the phone number there. And then when you sign up or make changes to your Medicare coverage, you and so if you don't already have Medicare, you can make changes during the initial enrollment period. Hold up, let me see. If you don't already have Medicare, your enrollment period are the following. So you have your initial enrollment period, and that again is going to be that 3 months before you turn 65. And then you have a special enrollment period, and those happens under certain circumstances. We'll get into that later. And then we have the general enrollment period that happens. We will go into that a little bit later too. But if you already have Medicare and you want to change how you receive your coverage, you can do that through these mechanisms. That will be during the open enrollment period, which is happening now. And then you have the Medicare Advantage open enrollment period. So we'll talk about that. Then there's a 5-star enrollment period. And then there's the special enrollment period known as an SEP for certain circumstances. So right now we're in that open enrollment period with Medicare. So it is a 7-week period. And it started a couple of days ago. So it started October 15th and ends December 7th. So coverage will begin. So through this 7-week period, you can enroll, disenroll, or switch Medicare Advantage plans or your Medicare drug plan. So this is the time to sort of look at things and make changes. So help your family with that. Coverage for the new selected plan or selected whatever changes you make will begin January 1st. So this is a time to review your health and drug plans and just make some different choices if you want to. Okay, so then as I mentioned before, there is a Medicare Advantage open enrollment period as well. And that open enrollment period is January 1st through March 31st. But for newly eligible Medicare Advantage, the open enrollment period is the first 3 months of entitlement of Medicare A and B. So for instance, how I mentioned that a person is about to turn 65, 3 months in advance, they need to reach out to the Social Security Administration or the railroad board. So that's 3 months before you turn 65. So then within that first month that they are in through the 3rd month that they have the services or Medicare, they have this open enrollment period where they can make changes and decide if they want to enroll into a Medicare Advantage plan. So that's from the 1st to the 3rd month. Okay, so they can, and here you can switch to another Medicare Advantage plan with or without a drug coverage. You can drop Medicare Advantage or you can return to original Medicare. Okay, so that is during for anyone who's not new to Medicare. That is during January 1st through March 31st. So it's almost hopping right after the Medicare open enrollment period. So the Medicare open enrollment period will end December 7th, and then here comes Medicare Advantage open enrollment period shortly after, which will begin January 1st through March 31st. So then there's the special enrollment periods, the SEPs that I was mentioning. So that is when these circumstances could happen. So if you move out of a service area, if you live at or leave a long-term care facility. So there's different reasons. If you lose your union coverage, And then there's also the situations where if you feel as if someone has enrolled you into a plan without your knowledge or without your consent, then you can request a special enrollment period then. You can call Medicare at 1-800 Medicare, and then you can file that complaint and request an SEP, and then CMS will consider granting granting an enrollment or disenrollment opportunity based on those circumstances. Because we do know that there are times where folks will reach out to people who are in Medicare and sort of make it sound like a really good idea to change into a Medicare Advantage plan. So we are aware of that. So there are those special enrollment periods that could be granted by contacting Medicare at 1-800 Medicare. So let's talk a little bit more about coverage. So what does Medicare cover? So for Part A, that is considered your hospital coverage. So that covers, here as you see on the slide, that is going to be your inpatient care in a hospital. So that includes items such as your a semi-private room. So you don't most of the time you don't get a room all to yourself. It will be a semi-private room. So you're sharing a room with someone. And then meals, general nursing services, and then you'll have drugs that are part of your inpatient hospital stay. So then just other hospital services and supplies are covered during your hospital stay. Inpatient care is also inpatient care in a skilled nursing facility after a 3-day inpatient hospital stay. So if you are in a hospital and you stay in a hospital at 3 days, you can be changed to a skilled nursing facility, and that's also under Part A. So that's covered under Part A of Medicare. That's your hospital insurance. This is continued. Part A helps to cover blood. So for instance, if you need blood while you're in the hospital, blood transfusion or something blood related, that is covered. Hospice care is under Part A, home health care, and then inpatient for religious non-medical care institution. And just for when it comes to paying for Part A, it changes each year. On this slide, we have 2023. Obviously, it's a little bit different each year. The payment changes, but the practice does not. So most people don't pay a premium for Part A, but if you lose a spouse, and you've paid into taxes for at least 10 years, you get Part A without paying a premium. So that is when you do not pay for Part A. You may have a penalty if you disenroll when you're first eligible. I mean, if you don't enroll. If you don't enroll when you're first eligible for Part A, you could be paying a penalty, and that will cause your monthly premium to increase up to 10%. So you could pay a higher premium. Okay, so then Part B. So that was Part A. So Part B, that's your medical insurance. So here's what that covers. So I'll just go through a few of those things. So it's going to be your doctor services. It's going to be outpatient medical and surgical services and supplies, and then services such as your diabetic testing equipment and supplies, and then even outpatient mental health services could be covered under Part B. So again, so that's going to be your medical insurance. Part A is your hospital insurance, and Part B is your medical insurance. So here's some of the services that Part A and Part B do not cover. So take a note of these. So that would include, so dental care is not covered, and vision for for prescription glasses, so your glasses are not covered. Dentures are not covered. Anything that's considered cosmetic surgery is not covered. And we massages, so you won't get your massages through your health insurance coverage with Medicare, not with Part A and Part B. Um, Hearing aids and exams for fitting them, and then also long-term care. So some that's not covered either. Those are extra costs of things. If you want to pay for extra costs, is not under your typical Part A and Part B for Medicare. So let's talk about, what do you pay? What are you paying to have Part B? So you have for 2024, again, this changes yearly. Sometimes it stays the same, but most of the time it increases some slightly. So your Part B monthly premium. A premium is what you pay like each month for a service, right? So that means it'll stay the same each month you pay this certain amount. So 174.70 is what it is for 2024. Some people may get Social Security benefits. The people who get Social Security benefits pay less due to statutory hold, things that hold you harmless for that provision. And then your premium may be higher if you didn't choose Part B when you first became eligible. Remember, I talked about you could have a penalty if you did not enroll into Part B when you became eligible. So with that 10% increase, so it could be a little bit higher. So then there's a yearly deductible for original Medicare for Part B. So for 2023, here are the deductible. So that means that there's co-insurance for Part B services. Okay, so let's talk about what that means. So a yearly deductible means you will meet a certain amount. So if you have a service, you have to meet a certain amount of what you pay out of pocket at that time of service, or throughout the service. So for instance, you have a doctor's visit one day, and that doctor's visit costs $110. Um, you pay the $110 because you have not met the $240 deductible yet, right? And then you go another visit and it's $110 again. You're gonna pay that again because that is then $220, right? Then the third visit, if it's still $110, you'll take $20 off of that because you still had $20 left for that yearly deductible to meet. And then you will take the balance of that, and then that will be split with the co-insurance. So you will pay 20% of what is left over, and then Medicare is paying the rest. So once you meet I'm a math person a little bit, so sorry if that was confusing. But once you meet the $240 yearly deductible, after that, then you will pay 20% of the covered amount of services. For most covered services, like your doctor's services and some of those preventive services, as long as your doctor accepts the assignment. So you have to make sure that that your doctor accepts the amount that is paid by Medicare. Okay. And same thing with outpatient mental health services and outpatient hospital services as well. Same. And as you'll note here, it's zero. You don't pay for most preventive services. So like your annual event, your annual services, just to stay with your preventive medicine, okay? So these are something to consider. Should you keep or sign up for your Part B, right? Most people do pay a monthly premium. So I was mentioning, did you pay a monthly premium, right? So each month you pay a premium, that certain amount, and then you also have that yearly deductible. So you meet your deductible, and then you start paying for your co-insurance for each visit after you meet the yearly deductible. So again, most people will pay a monthly premium. And then Part B may supplement employer coverage. So for instance, some people are still working at 65. So employers may supplement that coverage. Most cases, yes. So you would want to reach out to your employer plan to see what is going on. And even a lot of times when you retire, you work somewhere and you retired at 65, that employer may supplement some of that. Right. So in most cases they do, but you would need to check with your employer plan. And then Part D. So Part D is optional. You can choose a plan, and you can join it, right? You can choose and join the plan. Um, Pay a lifetime penalty if you join late. It's still optional, but you may have to pay a lifetime penalty if you join it late. Plans have formularies. So that formularies is a list of covered drugs. So this may include a range of drugs for each drug category. And and as you know, some of you may know, those lists change, but you will be notified. They're subject to change. Okay. Um, and then, so your out-of-pocket costs may be less if you use a preferred pharmacy. So some pharmacies give you a little bit of a discount if you use them, right? And then if you have limited income and resources, you can get extra help, and we'll go into extra help too. So this is very important to know that Medicare beneficiaries may qualify for extra help. And then Part D, which is your Medicare drug plan, the cost. This is what you can pay in 2024. Remember, with all of these costs vary or change each year. Okay, so most people will pay a monthly premium, so that's another one. It varies. And this one has a yearly deductible also. So here's another one that has a premium each month, and then a yearly deductible to meet. And then there are some co-payments or co-insurance, depending on what drug plan you choose, because they are different. You can choose different drug plans, and you can change them, right? So then there's some out-of-pocket costs that you may pay, where there could be a coverage gap, and that spending varies through each year. So very little after that the spending gap. So after $8,000 in out of pocket in 2004, you'll get an automatic catastrophic coverage. So that means you won't keep paying out of pocket. So this is just some updates with insulin products in Medicare coverage. So if you've taken insulin, there's great news. So some of you probably have heard this, that now you'll pay $35 a month or less for each covered insulin drug that you take. And you don't have to pay a deductible. So that means 35 a month as a premium or less, and then you don't have that anything extra like a deductible to pay. So here's just to kind of look at this on the slide. So that means if you have 90-day supply, no more than 105. This applies for everyone who takes insulin, and even if you get extra help. So that is new. So that is something great to know, that it's $35 to 35 a month or less to pay for your insulin related drugs, or insulin information. So, more with Part C, here's Part C. So that's that Medicare Advantage plans that we were talking about. So that's just another way to get your Part A, which is your hospital insurance, and Part B, which is your medical insurance coverage, is offered by pre-approved private companies that must follow the rules set by Medicare. So they have to follow rules that Medicare sets. Although these companies are not CMS companies who reach out to folks, they're private companies. Some probably don't follow rules, right? So that's when you can, sometimes if you find that someone is in a Part C plan and they probably really shouldn't be in a Part C plan, that's when you can request a special enrollment period to have them disenrolled. And then most Medicare Advantage plans do include some drug coverage, so Part D coverage. And in most cases, you'll need to use health care providers who participate in the plan's network. Some of them do have out of network coverage, but that is one thing about being in a Part C plan or Medicare Advantage plan. There are doctors who are in a network. They are contracted in a network. So folks have to be very careful that they don't go outside of that network, because their services will not be covered at the same amounts. So that's very, very important, because folks with original Medicare, original Part A and Part B original, you can kind of go all over. There's no network really, right? So with Part C plans, there's networks. So you have to be very, very careful about that if you do choose to be in a network service under Part C. And then another thing about part, and I'm just thinking about something I didn't mention on the other slide, is that for Part C, which are plans, Medicare Advantage plans, we don't want to say you don't always want it. There may be some times and choices where it makes sense to be in a plan, right? So if it's someone who may live in an urban area, right, where all of services can be easily, you can get to your services easily within that network. Also, if it's a individual who is above 65, pretty healthy, goes to the gym and all of that, right? Doesn't have many health issues. That year or so might make sense to have a Medicare Advantage plan. It's going to pay for their gym membership and pay for some extra things, right? So it works for some people. So it's not like taboo to have a Part C Medicare Advantage plan. It just, you have to just be careful about who gets one. It doesn't work well for someone who has Indian Health Service doctors that they're going to all the time, and those folks and those Indian Health Services providers may not be within the network. So, and that person is sick and they're used to seeing those people, and then all of a sudden they can't see them because they were enrolled into a Part C plan. So then that's where it's not going to work, right? So those are the things to think about. So here's some, looking on this slide, so here's some marketing and communications oversight improvements that was made in the plan year for 2024. So advertisers, so MA organizations can't advertise benefits that aren't available to beneficiaries in service areas where the marketing appears. And then market and any other they cannot market any products or plans, benefits or costs unless the MA organization marketing name. So here's just what some of the oversight improvements that was made, that CMS realized that a lot of the marketers were out there sort of doing their own thing, right? So CMS is aware and making changes to the way those private companies are marketing Medicare Advantage. So we can move to the next. Okay, so then this is just continued. So the ads will be prohibited if they don't mention their specific name. So they cannot try to be sort of sneaky about not mentioning their name. They can't say that they're with CMS, so there can't be anything that is that does not fit within the guidelines of CMS. And then they cannot like data cannot be older than the prior contract year. So it's just some guidelines that needs to be followed. So you can look at that on the slide if you want to screenshot this slide just to know some of those rules. So now let's talk about help for people with limited income and resources. So we have Medicare Savings Program, we have Medicaid, Extra Help, and then we also have CHIP that can help folks who have limited income and resources. So here are some of the minimum federal eligibility requirements for the Medicare Savings Program. And again, these limits change throughout the years or yearly. So you've heard of some of this is very important for folks who are trying to help beneficiaries who have limited income. So really pay close attention to this slide. So this is one of those ones that you want to screenshot and make note of. So they had those funny little acronyms like the QIMBY, SLIMBY, those things, QI. So that's when you hear people talking about that, that's what this is. So that is the qualified Medicare beneficiary. So that is QMB, right? So that is an individual who has monthly income limits of 1,275 if they're individual, and then if it's a married couple, it's 1,724 for that particular program. And what does it help pay for? On all the way over to the other side. You'll see it'll help. So QMB, qualified Medicare beneficiary, that help pay for Part A and Part B premiums and other cost sharing, like deductibles, co-insurance, co-payments that we talked about earlier. So that's what QMB helps pay for. And then you have, if we'll just take an example at the next one, that is specified low income Medicare beneficiary. That's the one, SLIMB. So that one goes up a little higher. That income limit for an individual monthly income limit is 1,526, and if they're married, you'll see that it's $2,064. That one covers Part B premiums only, or it helps with that, helps you pay for those. And then QI, qualified individual, same thing. Those income limits are a little higher for the individual and the married couple, and that pays for or helps pay for Part B premiums only. And then you have the qualified, disabled, and working individuals. That one's up a little higher. For an individual that is monthly, that income limit is $5,105. And for a married couple, you see that it's above 6,000, close to 7,000. So that one helps with Part A premiums only. So remember, premiums are monthly payments. So we have premiums, and then we have other things that you're paying for, like cost sharing. So cost sharing is deductibles, co-insurance, and co-payments after, then co-insurance, and it's something that you pay for after you meet your deductible. So those are the terms and things that you want to start getting familiar with. Okay, what is extra help? So it's a program to help people pay for Medicare drug costs in Part D. And that's also known as the low income subsidy, right? So that's LIS. So you probably heard of, sometimes if you're helping someone with Medicare, LIS, that's what that is. If you had the lowest income and resources, you pay no premiums or deductibles, or just small or no co-payments. If you have slightly higher income and resources, you pay a reduced deductible or little out-of-pocket payments, or yeah, have some smaller out-of-pocket payments than what someone normally would. And then no coverage gap or late enrollment penalty if you qualify for extra help. So you won't have that late enrollment penalty the way if you're eligible for Medicare and you don't sign up for it on time and you get that 10% increase. So if you qualify for extra help, you don't have that. And then for qualifying for extra help, here's some of those guidelines to think about. You automatically qualify for extra help if you get full Medicaid coverage. If you get SSI, which is your supplemental security income. And then also if you receive help from Medicaid paying for Medicare premiums. Okay, so if you get help for from Medicaid, and they help you pay for Medicare premiums, like those monthly payments, then that's extra help, right? So if you don't automatically qualify, you must apply online. So you would apply online with Social Security, and that is that link here, which is the ssa.gov/benefits/Medicare/prescription help.html. I'm going to read it again. That is, if you are applying online, that is ssa.gov/benefits/Medicare/prescription help.html. Or make it easier, call Social Security at 1-800-772-1213. Again, that phone number is 1-800-772-1213. 772-1213. So here's some temporary Medicare telehealth changes to note. And this is coming up. This the temporary telehealth changes are through December 31st, 2024. So that's when the temporary changes end, which is going to be happening soon, right? Oh my goodness, this time is just going by so fast, right? So those changes are a federally qualified health center, FQHC, or rural health clinic can serve as a distant site provider for non-behavioral and mental health telehealth services. I'm just going to name a few. I'm not going to go through them all. And then generally, any provider who can bill Medicare can bill for telehealth services through December 31st of this year. And there are no geographic restrictions for originating site for non-behavioral and mental health teleservices. So take a screenshot of this one. So again, these changes, which are temporary changes for Medicare telehealth, these will end in a few short weeks or a few short several weeks at the end of December 31st of this year. And then here are permanent Medicare telehealth policy changes. So these are some changes that ended up being permanent. We talked about the ones that were temporary, and then these are the permanent changes. So take a look at this slide. You'll see instances where it's federally qualified health centers or FQHCs and rural health clinics can serve as a distance site provider for behavioral mental health, telehealth services. So these are going to stay as permanent changes. And then rural hospital emergency departments can be an originating site. So a lot of these, if you kind of look at it, will cover your behavioral mental health care services, right? So that's a big issue that people need to make sure that they are aware of. So here are some helpful websites. So we talked about Medicare, and then we briefed a little bit about Medicaid, and if someone is having Medicare and Medicaid. Social Security's website is here. And also we don't never want to leave out the health insurance marketplace, where to find that information. Children's Health Insurance Program is here. And then even the CMS National Training Program, we put that link there as well, because you can go there all the time and find information that is new and relevant that's happening with Medicare and other programs within CMS. And then there's also the SHIP information that's here as well for SHIP help. So thank you so much for joining. Keep in mind that materials related to the presentation can be downloaded from our spotlight page at the CMS American Indian and Alaska Native Outreach and Education website at go.cms.gov/AIAN. And again, as always, and you can always submit any inquiries to the CMS Division of Tribal Affairs at our mailbox. And that mailbox is tribalaffairs@cms.hhs.gov. Again, that is tribalaffairs@cms.hhs.gov. All righty. Thank you so much for joining.